We are live.
Welcome to Appna's YouTube channel. Good morning and Assalamu alaikum, everyone. This is Umar Tariq. I am lead media subcommittee of Appna Ypc and chair of Ypc Ghana. We are doing this workshop on CV presentation today. So I welcome each one of you who could join us on this Sunday morning. I have a diverse group of panelists. I'm going to introduce each one of them. We have Dr. Amna Qureshi here. She's an assistant professor at St. Louis University. She's a staff pathologist and a very good friend. Thank you very much, Amna Baji, for being here. Next, I have my classmate, Dr. Sultan Naid. We went to school and college together. He's a great friend, and I'm very proud that he's here. I'm very proud of all his accomplishments. He is the director of Third Space GI program at UPMC, and he's assistant professor of medicine at UPMC. Next, we have Dr. Salina Arif. She is currently working as geriatric cardiology fellow at McGill University and Montreal, Canada. Welcome you all. So we will start with a brief presentation by Dr. Arif, and then we'll have comments from the panelists for a couple of minutes about their thoughts on CV, and then we will be taking questions. So I request to each one of you that please keep it interactive. I already said that, I'll have you guys raise your hand virtually. I'll promote you to panelists. You can come live and ask your questions. If you don't want to switch on the camera, you can ask your questions in the QA section in the Zoom meeting below or in the YouTube live chat. All right, starting with that, I'm going to have Dr. Salina Arif come forward and start with her presentation.
Assalamu alaikum, everyone. So I'm going to basically jump right in on the CV. So initially, okay, I'm good. Can you all guys see my screen? Okay.
Yes, we can. Thank you.
Yeah. All right. So I'm going to jump kind of straight in. I've taken my examples from the new ERAS applicant worksheet. Basically, they have changed the format of the CV. And the initial sections are usual, like you have to mention your education, your medical education, any postgraduate training that you may have had with the year, with, the names of department and everything. But what's really important and what kind of is going to make you stand out or what you have to highlight are your experiences. So I've focused it on the ERAS applicant worksheet. However, obviously, some of you may be applying for observerships, electives, and the CV you may be making the CV for that reason. But I think it's a good good advice that you start practicing making your CV in lines of how the ERAS CV is, so that in the future it's going to help you. So now for the ERAS CV, what they have is they want you to list up to 10 experiences, and then you're going to highlight the 3 experiences that you think are the most relevant to you or are most meaningful to you. And then basically, like, you have to start with the experience type, and then I'm going to tell you what else do they want. So the first section, you're going to organization experience type. So experience type, that you can have different kinds of experiences like work, research, volunteer experience, education, training, extracurricular, any professional organization or teaching or mentoring experience. The next thing is, from that particular experience type, then what was the primary focus area? So primary focus area can be basic science like physiology, anatomy, or clinical or translational science, community involvement, outreach, healthcare administration, improving access to healthcare, medical education, or it could be extracurricular like musical, athletics, art, could be wellness promotion, public health, quality improvement, social justice, advocacy. And then the next thing they want you to pick out is the key characteristic. What did that experience help you build? What kind of characteristic did it help, like, hone or polish? So that could be communication skills, critical thinking, problem solving, cultural humility, awareness, empathy, compassion, ingenuity, innovation, reliability, dependability, resilience, adaptability, self-reflection, improvement, and then teamwork and leadership, which I feel like for North American programs, teamwork and leadership, it weighs a lot in your CV. So when you're writing about your different experiences, then you're gonna make sure that whatever the description is, it's relevant to the experience type, the primary focus area, and then the key characteristic. You don't want to skip out on that. So you just don't want to give like a little narrative of what you did, but how it basically helped improve any skill, or what with an example, you're going to show that this is how it links to teamwork or leadership or communication skills or critical thinking and problem solving. So what I did here was I took my CV from 10 years ago and I dissected it, and I was like, okay, now according to the new criteria, how could I improved my CV? So I'm just going to quickly go over a few examples. So this is the first example is medical student US clinical observership. So I did an observership at Emory University in cardiology back in 2011. So looking at my previous CV, I think what I've done is I've just literally listed, okay, I accompanied the granite heart failure team. I looked at these devices, ECMO, balloon pump, etc. And then I observed right heart caths. I visited outpatient clinic, but I haven't really focused on how did that help me. So I think if I were revising, I would put that this strengthened my communication and teamwork skills. It contributed to like positive patient outcomes. And these are just examples. These are not all inclusive, but just to give you an idea. Now, the second one, again, this is a clinical elective in cardiology. Again, I think what I had done, and those were simpler times. You just had to list everything, but I think now it's more competitive. So you really want to stand out, and you really want to highlight your capabilities. So again, this is just a list of things I did like in the elective, but I think you want to specifically mention that you collaborated effectively with multidisciplinary teams. You were able to deliver high quality patient care. You were able to develop teamwork, communication skills, so that it kind of tallies onto your key focus area as well as the key characteristic that you are going to highlight. This is from medical house officer. A lot of us did child and family psychiatry when we were preparing for our USMLEs. So again, I think back then, very naive. So just a simple list of what I did, but I think now you want to use some buzzwords, some action-oriented words. Any particular example that you may have. So you want to say you successfully managed the care of children and adolescents, you like fostered collaborative communicative environment, or you ensured reliability through your on-call shifts, or like whatever example that you may have. This is a house surgeon in cardiovascular surgery. A lot of us did that too when preparing for USMLEs back then. So you want to talk about like you responsibly delivered specialized care, you develop proficiency in some particular skill, and you maintain a high level of professionalism. When you're talking about surgery, you may want to mention something like you were very strict about like safety protocols, or something like that. Some things that are, much appreciated in the North American healthcare system specifically. And then this is another elective, nephrology. So again, you want to talk about like demonstrated commitment to research, actively engaged in conferences, and then maybe you want to point out like it helped refine your critical thinking, analytical skills, and then you can, according to that, you can check the key focus and the key characteristic from the CV. A lot of you may have, if you're from King Edward, you may have on your experience, you may have your participation in the Students Patient Welfare Society. So back in 2011, basically just listing each and every single workshop we attended, training we attended, any project that we did. But now it's different because you can only list up to 10 experiences. So what you want to do is you can take Student Patients Welfare Society as one experience, and then you can kind of highlight maybe a couple projects or how those projects help you. For instance, if I was to do it again for the new format, I would just maybe put that train and blast management workshop, showcasing adeptness in handling critical situations, then spearheaded impactful projects in collaboration with external organizations, pioneered a relief goods collection, supervised successful charity fundraiser, coordinated with other hospital teams in affected regions to ensure a steady supply of medical necessities. So instead of listing everything, because that's going to waste the 10 experiences on your CV, maybe just each society, each professional organization as a whole, and then just highlight what you did in that. So same goes for like community medicine. And then I think back then we had some WHO-led initiatives. So again, you can combine similar sort of experiences under one heading, and then make sure that you are highlighting specific characteristics, like you were empowering in underserved communities, you mentored, you raised awareness, and this showed your commitment to healthcare accessibility and community well-being, which are there in the key focus areas as well as key characteristics: improving healthcare accessibility, promotion, wellness promotion, etc. So this is it. And then if you have more questions, just feel free to email me. You can take my email. And these are just some tips, which I always tell the medical students, that when you're sending an email, make sure that you are addressing professionally, avoid Baji and Bhai unless you know somebody personally. Don't be vague. Try include as much detail about yourself as you can, but don't write an essay because nobody's going to have time to read that. You can wait at least 2 weeks before you bother or pester with more emails. And do not send friend requests on Facebook or other social media like Instagram. It's okay to follow on Twitter. All right. So
Thank you much, Selena.
Yeah, I think I'm going to stop
Thanks.
sharing my screen, and then we can
Sure.
go to questions.
Yep. Thank you, Selena. This was very elaborate. And yeah, I will echo the same sentiments that Dr. Do you go as Dr. Arif or Dr. Gul now?
Dr. Arif.
Okay. Yeah, I'll echo the same sentiments that Dr. Arif presented. Please, I don't know, I get anywhere from 20 to 30 friend requests on social media every day. They're not helping anyone. If anything, they're more of a nuisance. So following someone on Twitter, linking with them on LinkedIn is all okay. But, you know, Instagram and Facebook is not for that, or not for any professional communication. Neither is WhatsApp, you know. So please don't do any direct messages. Email people if you have questions, and, you know, they just follow the general protocols of communication. Keep it very to the point, concise, and short. Sending long essays, if I see a question with more than 3-4 sentences, I'm not going to answer because it will take that much of a time. All right, with that, I'm going to go to Dr. Qureshi. Dr. Amna Qureshi, she's going to give her quick thoughts on CV for a minute or two, and then we'll go to Dr. Mahmood, and then we'll take questions. Amna, would you please come forward?
You're muted right now, Ramna.
Okay,
you're muted
Sultan,
again.
it's okay. Is she muted again? Let's see.
Okay, I think now I'm unmuted.
Good.
Sorry.
Yes,
So
no
thank
worries.
you, Umar, for having me, and thank you, Dr. Arif, for your elaborative presentation. So I have just few more things to add. This is like basically the ERAS application, which you are basically like, filling a template. But there are other things like, your regular CV, that is not ERAS CV. It's just like you are making a CV to apply for a position, be it as a medical student, like an elective position, or, you're emailing program directors or different programs that you're interested in the residency spot. So you make like a small CV of yourself. So there is a difference between CV and resume, but in US, we are using it interchangeably. Resume is like a very short document of your experience, but CV can be a little lengthy. But of course, your ERAS CV is going to be pretty long compared to both of them. And basically, you're just filling the template, like maybe who's your mentor or how many hours. You don't have to mention all this in your regular CV. In the regular CV, you're going to give your email that is functioning and that you actually check. Obviously, your name, your designation, as Umar had a very nice presentation on YouTube before, and I think it's very helpful. The visa status is also very helpful. Then your education, if you are, as Umar mentioned in his video, I got the opportunity to see it. Your, where you are graduating from, or what's your expected date of graduation, your USMLE scores. These are very important. But when I am, if a medical student emails me, or if a potential resident emails me, not the ERAS application, but the CV, it's basically a brief introduction of that individual to me. I don't know that individual. I've never worked with that individual, but how I am going to look into, look him or her as a potential candidate is through the CV. And it needs to be genuine. I mean, you are not copy pasting from other people's experience. It's something that you will be discussing with me, and maybe I can pick up any of your experience and I want to talk about it, and then you get blank if you have copy pasted it from somebody. The other thing I want to make sure that the CV you email me as a potential candidate for, let's say, observership, or let's say as a resident or a fellow, no grammatical mistakes, please. If you are making a lot of grammatical mistakes, I'm a pathologist. I don't know if you know, we actually, do a lot of reports, and those reports don't, I mean, they have to be very, very concise and like grammatically correct. And that's what I look for in my residents. How are they? They don't have to be very fancy with their English language, but at least they need to know their basics. Where should be your full stop, where should be or your comma, these basic things. And I mean, you don't have to be perfect, but at least you need to know how to make sentences, right? So your CV should be without grammatical mistakes, please. Genuine, original, not plagiarized. And you know what, we will find it out. And it should be, like what you've really done in the past. I mean, you don't have to look fancy. If you haven't done much of research, it's okay. I mean, it's okay to say that you've not published papers, rather than putting your names in the publications. You just, you did not know much about it. So I mean, we can figure out that. And we know that in Pakistan, there are not much opportunities, but that's okay. I mean, it's okay. You are not, you will not be penalized, but yes, you will be penalized if we find out that, you're totally blank about a research, and you just, your friend was in there, and then you asked your friend to, put your name in there. So that puts a very, very bad impression of you, when you can send me a very beautiful CV, but then when I sit with you and talk about it, it can leave a very bad impression. And whatever you send me, you need to know it. You need to know your CV by heart. It's not like you've made a CV like 5 months back, and now you've sent it to me and you have an interview with me, and now you're totally, you don't know about many experiences that you might have put. So these things, they matter a lot. So be very careful about these things. You need to know your CV by heart. You need to know your personal statement by heart. If you've mentioned a nice experience, I'm sorry, I'm going in a tangent here, but if you've discussed an interesting case in your personal statement, and now I'm asking you, and now you don't remember it, so that puts a very bad impression. So be very careful about these things. Your CV need to be concise. It should not make you look very fancy. And if you are actually very well accomplished, please know your CV by heart. And that's my 2 cents for now.
Thank you very much, Dr. Qureshi. Next, we will have Dr. Mahmood. Sultan, please come forward.
Hi, everyone. So my name is Sultan Mahmood. Most of my experience reviewing CVs comes from my role as a co-program director of the GI fellowship programs. So over there, we had, I guess, much less, number of applications compared to somebody who's reviewing applications for an internal medicine residency. But I think the most important thing that I would say for the CV is that less is more. We feel like we have to put in everything that we have done in our entire lives into that CV, and we have to write like big paragraphs about what we did during that rotation or during that experience, but that is actually not important. When I was reviewing applications, we get like 300 applications for a fellowship program. So 300 to me was a lot. I had to review half of those applications, which is 150 applications. So I could only give just a couple of minutes to one application. So in a couple of minutes, I mean, if there is like 3 or 4 pages, a lot of paragraphs, I will just quickly glance over it. If I don't find anything that I can connect with, I'm just going to move on to the next CV. So if you're putting in too many words, there might be something which might be very unique for you, which I might be able to connect with. Like say that you've done a great presentation on something in your program, but there's like SPWS experience, or you're talking about all other things that I'm not really interested in, and that important piece of information is in there somewhere, I may miss out on that. And there's a lot of like, I'm very hardworking and I saw this. Those are the things that people really don't care about. So if you instead of writing about like 10 experiences, if you write 5 experiences which are actually unique, which are different from other people, that is going to be more eye-catching. That is something that I will be able to connect with, and you're more likely to be picked. And it is okay. You don't have to write big paragraphs. Write like 2 lines, but just keep it simple. If you and just think about something which makes you unique, which is again everybody's going to be different. Maybe your cousin has autism, and that is something which is the reason that you went into medicine. So that's something that you want to highlight, and that's something that I can connect with. Or you have a, or sometimes when people say, I have a cat, I guess. I mean, you just write about your cat, and okay, man, I have a cat too. So you can just connect with that. So those are the things that you can connect with. So you don't really have to go into the details about like a lot of like random things that you have done in your experiences. That would be the main thing that I would say. I think Amna actually did touch on a very important thing about making grammatical mistakes. And you guys are so lucky now, like you have like so many apps, and like Grammarly is available free now on all of your Google. So, I mean, I make a lot of mistakes in my email. So I always check it with Grammarly. And if I'm writing an email, I feel like, what, the English does not look great for me. I use ChatGPT, or I will use Bard AI to make my email more professional. So I can see that all of these tools which are available free of cost to all of you guys, I mean, you should definitely be using those.
Thank you very much, Sultan. So talking about how one can relate, I was the president of Patient Welfare Society, SPWS, and I talked about what I did, what are the changes I brought in SPWS, and a lot of people, my people who were interviewing me, they asked me about it. It's about how you share your experiences. Okay, so we're going to take questions. I'm going to start with Sindhu Mukesh and then Suraj Kumar. So quick reminder, please come forward, introduce yourself with your name, your year of graduation, your med school, and your specialty of interest, and then ask your question. Make sure your questions are written before you ask, and so you're just reading your question. Okay, please, Sindhu, come forward.
So I'm Dr. Sindhu, and I'm from the Akkad University of Medical and Health Sciences, Jamshoro. My year of graduation is 2022, and I'm applying for residency in neurology in this cycle. And I am ECFMG certified. So my concern is that I have a lack in my CV. I don't have US visa, so I could not travel to the United States for a US clinic experience. And I don't have LORs from USMD. So is there any way I can fill that lack or gap? Any alternate, or you think I should wait next year and apply next year, get my visa and get US clinic experience and get LORs and apply next year?
Thank you, Sindhu. Any of the panelists want to take this question?
So I think you should apply, go for it. The other thing is, I don't know, there are some tele rotations available. Yes, so you can contact them, get your visa, always apply. Like, never think that you don't have one thing. You can be lucky anytime. So and you are a fresh graduate, and that counts a lot. Try to give your step 3. And okay. Then also I don't know, but I think people are getting visas basis on step 3. So apply for step 3. You are already CFFG certified. See yes. If there are tele rotations available, you can do that. And you can just apply with the LORs from Pakistan. I mean, you don't have to. When I was, I applied in pathology, and I had only 2 LORs from US. I did my electives from US, but I think I just had 2 LORs, and 1 LOR I got from back home. So it didn't matter, and I was fresh graduate, so I matched. So the reason I'm telling you is, like, forget it. If you don't have US experience, don't worry about it. Just go for it. Give it a shot. It's worth it. I'm telling you.
Thank you.
So Sindhu, really quick. So every year, many people match without any US LORs, you know. So let me tell you, it is an icing on the cake, but it's not the cake. So yes, it is needed. It's preferable. Your likelihood of matching, your chances of matching are much higher. But looking at the data from last year, there were people who matched without a US LOR. Again, there were few. The likelihood is less, but again, there are people. You would need to just focus more on your CV and personal statement. And there's still opportunities. Try to get observership, try to get a remote research opportunity, try to do research yourself in Pakistan.
I do research.
Do some, good.
I do research. What
Good.
else I
So,
can do to fill that bag?
You're doing the right things. Just keep applying for observership. Try applying for visa based on step 3 if you can. And if you get lucky, try to get an observership. If not, then again, you know, it is what it is, and you just try your luck. And to answer that part of your question, should you apply for residency this year? I was in a similar situation. I remember August 2011, and I just had my CS in step 1, and I was doing research at Stanford University, and I was wondering, well, radiology is pretty competitive. I'm an interventional radiologist, so should I even bother applying? And I'm like, I don't know how this process works, you know. So apply karte hain, shayad ho jaye, dekhte hain. So I applied only with the step 1 and CS, and I had my CK pending. I think I took it, I don't know, September, mid-September. Sultan is here. I remember I talked to him and he said, dude, your likelihood of matching is pretty low. It was low, but I matched. I got really lucky and I matched with just that. So now I think I was able to save a year. So yes, perfect never happens. You know, you might get all these ducks in a row, but always apply, even if you don't have, like, I have gotten so many questions, you know, that I don't have this, I don't have that. That just means that you should focus on other things in your application. And remember, the PDs take a holistic approach. They're not looking just at, let's say, your US clinical experience or your personal statement or your CV alone. It's the combined thing. Like the CV has is an important portion, personal statement is an important portion, your scores, your US experience, and then your interview skills, they matter. Your communications, how you send an email, how you present yourself. Like, look at that. For a reason, I changed all the panelists' name. Look at their name. It's full name, comma, MD. You know, what are your pictures on Facebook, LinkedIn, Twitter, wherever you are? Do they look like professional pictures? Are they reasonable, or you're embarrassed to show your pictures on all these platforms? So all these things matter. Just focus on everything else at the same time. Okay? Did that answer your question?
Yeah, it did. So what do you think are my likelihoods of matching? Like if I apply without LORs?
7.34%. Nobody can give you an exact number. I'm kidding. I'm kidding. Nobody can give you an exact percentage, right? That's what I'm trying to tell you. It is decent. Okay. I don't know your scores. I don't know your personal statement and CV. Like I said, you know, those are significant portions. So nobody can give you a percentage or likelihood. I'll say it's decent. Just work on everything else. Okay.
Okay. Thank
you. So next we will have Suraj Kumar. Suraj, please come forward.
Thank you so much, Dr. Tariq, Dr. Arif, Dr. Qureshi, and Dr. Mahmood for arranging this seminar. Good morning, everyone. My name is Dr. Suresh Kumar. I graduated from Liaquat University of Medical Health Sciences, Jamshoro in 2017, and this would be my second match cycle. So I have two questions. One is regarding the RAS CV, and other one is regarding, I mean, just a small thing regarding personal statement, but I don't know if I should ask it here or in the next seminar when you arrange for the PS. So I'll just go for the RAS CV question. So this year, as they have done it, you have the limited 10 experiences and 1 impactful experience. And from 10 experiences, they need 3 meaningful experiences. So these 3 meaningful experiences should be different. One should be community work. The other one should be your back home residency or RMO-ship. And the third could be research work, or all 3 should be related to the clinical work. One question. And the second one is that impactful experience. So what should we write in the impactful experience? Again, the same thing. Just the community work, like we have the patient welfare societies, we work there, or a residency or internship experience.
Thank you, Suraj. I'll let Dr. Arif answer that. Selena, go ahead.
So the 3 meaningful experiences can be the same or be different. It's really up to you, because it has to make meaning to you. You cannot just list what clinical skill you learned in that meaningful experience. It has to be something personal. For instance, if I was to write about like, why am I here in Canada doing this geriatric cardiology fellowship and master's? So to me, it's meaningful because it helps me balance my professional and personal commitments. It helps me learn that how to take your different endeavors to fruition, to how to complete the tasks that you set out for. So that instead of writing, oh, I'm such a skilled researcher now, or I'm a geriatric cardiologist or whatever. So it has to make meaning to you. And then, so it would be ideal if those can be 3 different kind of experiences. So that can highlight 3 different characteristics. Like maybe, like you just pointed out, one could be community, one could be your clinical based, and one could be research based. And it will also make it easier to highlight different areas then, if you have 3 different experiences which are meaningful. But if you don't, and if really like you like your nephrology rotation, or that was meaningful to you, maybe because you have a family member who is undergoing dialysis, or cancer rotation because you have a family member or something. So it just has to show some sort of a personal connection. It cannot be just like a reiteration of your CV, basically, like just the experience itself. So those can be impactful. And then your second question about impactful, I don't know, were you talking about the optional section, which is something like high impact, or were you?
Yes. Any impactful experience? So 3 meaningful, and how should we differentiate between 3 meaningful and 1 impactful experience?
Okay, so the 1 impactful experience, that section is actually optional. No, everybody doesn't have to fill it. If you go in the FAQs, or I don't know if there is like a different section where it gives an explanation of what goes in the impactful experience. So that is, if you had some sort of a major life experience, for instance, like your, death of a parent, death of a young sibling, death of a child, something like that, or your own health experience, or if you're a refugee, asylee, or it also includes if you had a lack of opportunities in terms of academic opportunities or mentorship. So that you can also add that. So from Pakistan, maybe you can add like how you don't really have a lot of like research opportunities. So that could be something that you could add in there, but don't fill it out with something that would be very general, like a lot of other people might be writing it too. So it really has to be something of high impact, something that kind of sets you out from the other people. Or I don't know how and Dr. Mahmood might know, since he views these applications, like how the faculty is actually weighing that into your whole application. I'm not really sure. But my understanding from the description is that it has to be something that's very different. It's not really just a general, like I did this rotation and it really helped me learn this or that. It's something like maybe you lost your house in the floods or something like that. It has to be like really major.
Thank you, Selena. So I'll also add to that. So let me tell you what they say. They say, please describe any challenges or hardships that influenced your journey to residency. This could include experiences related to family background, financial background, community settings, educational experiences, or general life experiences. Right? Please consider whether this question applies to you. Programs do not expect all applicants to complete this question. This question is intended for applicants who have overcome major challenges or obstacles. Some applicants may not have experiences that are relevant to this question. Other applicants may not feel comfortable sharing personal information in their application. So it's totally up to you. If I am answering this question, if I was answering this question 10, 12 years ago, I would have mentioned there were a couple of things that were my personal challenges and they really impacted me. I worked as president of Patient Welfare Society, Sultan, Dr. Appna Qureshi, and Selena. They were all part of it in different capacities. I learned from Dr. Appna Qureshi because she was, I think, she was the lady president a couple of years ahead of me. So I learned a lot from her. Sultan was with me. He was a general secretary. Selena followed us a couple of years later. So that we did a lot of medical camps. We went to remote areas. We established a dispensary. We used to sit there. We donated a lot of medical equipment. We would go to wards and give free stuff to children, pediatric population, and there was a lot of stuff we did. It's actually my CV video that I shared with you guys to see before coming to this. So that was my impactful experience. That taught me that the value of timely help. Sometimes we were not able to arrange funds. Let's say somebody needed blood. We weren't able to arrange it in a timely fashion. Then we learned that providing help alone is not important. Providing timely help is important. The value of time, the value of efficiency. So that was an impactful experience for me at that time. Now, if anybody asks me what are an impactful experience, I will talk about my personal health challenges. I've had a lot of health setbacks and overcoming diseases, undergoing surgeries and recovering from them. It gives you a certain resilience. I don't think there's anything bigger and anything that gives you more strength than overcoming pain. Now and your impactful experiences will keep on changing, and they are different for everyone. So this is a question that you need to sit with yourself and think, what are the few experiences that shaped my life,
Right.
that may change जिसको उर्दू में मैं कहूंगा कि मेरी जिंदगी का रुख बदल दिया, right? What are the impactful ones and what are the meaningful ones? बात एक ही है, it's the same thing, impactful versus meaningful. But the point is the most significant one, you should mention it in the impactful. Okay, I hope this answered your question. Do you have any other question?
Sure. So like the challenges or the hardships that students have been facing to come to the United States and finding accommodations or such kind of things, would that be an impactful experience or no?
Yes, I mentioned that because I was beaten and mugged in Baltimore when I was working at Hopkins. And I got a disc herniation, multiple years of physical therapy, nothing worked. Had to get a spine injection, didn't work, had to get a spine surgery to remove that disc. That was a big challenge because I couldn't find an accommodation in a safe area. And when I found it, it wasn't safe anyways. This happened, right? So that was a very significant, impactful experience. I mentioned about that in my personal statement too, and there was a long discussion and all that. So yeah, you can talk about all this stuff. Whatever challenges you face, it could be financial as well. A lot of people are forced to do odd jobs, are forced to take loans with horrible terms and conditions. Again, to each his own. Right? Everybody has their own unique journey, and you got to address that based on your journey. All right. I hope that answered your question. Do you have any follow-up questions, Suresh?
Yeah. So regarding this as well, so 10 experiences. So how would we, because there will be a discrepancy of the dates of the experiences. And for example, if I have done, because I'm a second time applying match, so there would be 10 experiences for my observerships there from the residency programs. So of course, I'm limited to 10 programs, 10 experiences. I cannot put all of those 10 experiences in the CV now, those 10 rotations. And if I'm just going to put 3 or 4 rotations, which were really meaningful, so would that give a negative impact on that program where I'm applying to, but I haven't written their experience in the CV?
So no, it's not that it's absolutely not like that. These meaningful and impactful experiences should not be program specific. They should be applicant specific. So Dr. Suraj Kumar, there's only one Dr. Suraj Kumar sitting in front of me in this blue shirt. There is no other Dr. Suraj Kumar, right? So these experiences should not change with programs. This is not your personal statement. You can write a personal statement for every program, but your meaningful and impactful experiences are dependent on the applicant, not the program you're applying to. Okay?
No, not the meaningful. I mean, the meaningful are only 3, but total 10 experiences. And in 10 experiences, if I just write 3 observership experience and not the other hospital rotations, so they will not take it as negative?
No.
Because I rotated there, but I haven't mentioned their experience in that.
That's fine.
In total
that's fine.
10
They don't
experiences.
accept. Yeah, that's fine. As long as you mentioned it in your CV, that's fine. For me, I worked at Yale Emergency Medicine, NIH Heme-Oncology, and UCSF Radiology. What I resonated the most was UCSF Radiology, and I would have listed that, and that's fine. You can't have you're going to resonate with one place more than the other. You will have better experience at one place than the other. Okay. In the interest of time, I'll move forward so that we give a chance to more applicants. Thank you, Suraj. So next, I'm going to have questions from Dr. Mariam Mahmood and Dr. We had Dr. Muhammad Abdullah here, if he's still around. Yeah, so I'll take questions from these 2 guys. I request to all the participants, please don't send messages in the chat. If you have questions, send it in the Q&A so that I have that one section to look at rather than multiple ones. So Mariam, please come forward. Also, a quick reminder, if you have a question for a specific panelist, please mention that at the end of your question, that this question is for Dr. Arif, Dr. Mahmood, or Dr. Qureshi. Thank you. Mariam.
Hey, hello everybody. How are you guys doing? Thank you so much, Dr. Tariq, for this session. And good to meet Dr. Mahmood, Dr. Arif, and Dr. Qureshi. I know it's a Sunday morning for everybody, so thank you so much for arranging this. So first of all, I'm sorry for adding a question in my chat box because I couldn't write it in the question box. I think it's because I'm a panelist, that's why. Maybe, my first question is actually a follow-up for that question, like your impactful experiences. So how do you make sure your impactful experiences, if you're talking about death of somebody or something, it's not like a sad sob story to your program directors? How do you make it into a powerful story that they won't look down upon you, like something like, everybody says talk about a past experience and everything, but how do you make it into something that they will want you? Not that they think bad about it. Oh, that was such a bad thing for him. Maybe he's, suffering from PTSD through that or something like that, So how do you make that experience into like a moderate experience and like impactful experience, but something that they would be like, okay, that shows resilience. How do you turn an experience into that?
Okay, thank you, Mariam. So we'll take that to Dr. Mahmood, and then I'll also add to that. Sultan, please come forward.
Thank you.
Yeah, so I think in the US, I think in general, people love stories. Every experience that you're going to talk about, your personal statement, it should all be stories. So instead of saying, okay, I'm very hardworking, you say, you know what, I went over there, they asked me to come in at 6 a.m. It was difficult for me to find a train, but still got the train. I was there at 6 a.m. every day and I left at 6 p.m. So stories are more important than just saying that, oh, I had a very bad experience somewhere. So stories are important. So whenever the way that you make something impactful is that you start off with a story, but at the end you say, you know what, I learned something from it. Like, I know that everybody's grandmother dies whenever they're applying for ERAS residency. But just turn that around. At the end of the day, you know what, my grandmother died, but then I was there helping her out in the last days. I helped putting in the NG tube when I was replacing the NG tube, and that just they understood what the importance of the healthcare workers is, and then just gave me a lot of empathy, and I wanted to take that out and help out other people. So it should be a story, but at the end of the day, you learn something from it, and you want to take that forward and change something about yourself in the future. This is how you can get death of anybody or cancer or whatever. You can actually make that positive at the end. That's what they want to hear. And failures are completely fine. If you fail at something, you applied for a match, you didn't match, and you're applying again, that is not negative at all. This is actually a very positive thing. If somebody, despite failing, is resilient enough that they're applying again for the residency, this is actually a positive thing. I know that in Pakistan, we used to like always winning, always coming first and everything, but that's not the case. Failures are a part of life, and you have to accept it, make yourself better, and then move on.
Thank you, Sultan. So I'll add, a couple of things, Mariam, here. So let's start with failure. I failed my step 2 CS exam, and I mentioned that in my personal statement that why I did not give up. I did research for multiple years after that, and the reason I did that because I decided that I will not let one failure decide the destiny of my professional life. That's not what I am. That's not my resilience. That's not my grit. I don't give up, and one failure cannot do that to me. And same thing about death of a loved one. I would request each one of you. There are 65 attendees here right now. Please, all 65 of you cannot have a death of your family member, a grandmom, at the start of your personal statement. Like I said, the most important thing is that your CV, your personal statement, your interview, your impactful experiences, your meaningful experiences should be personalized. If even there are like 3 or 4 applicants with similar impactful, similar meaningful experiences, then that's gonna actually harm and impact you. हम लोग जो भी यहाँ बैठे हैं, हम सब भी सबसे गुजरे हैं. हम बेवकूफ नहीं हैं. Don't insult our intelligence or brilliance. When there are 4 people with similar impactful experiences, we know what's going on. And we will purposely make sure we don't interview you or you're ranked lower. So make sure your CVs are genuine, your personal statements are genuine, your impactful and meaningful experiences are genuine. So talking about death of loved one, there were a few deaths in my family that really impacted me. And I talked about them when I was asked that what I learned from those experiences, overcoming personal trauma, overcoming grief always teaches you something. And what you learn from that, nobody really cares what happened. Like, honestly, to put it bluntly, nobody cares about your grandmother or your uncle or your aunt dying. What they care about, how that impacted you. And somehow as humans, we care about happy ending. So what I mean is, like, they want to see how it turned into a happy ending for your life. And it could be a sad ending. But that's the whole reason you're mentioning that, okay, this happened in my family. For example, I heard my grandmother died, and half an hour later I was working. And I was sad, but I learned that, unfortunately, I learned to compartmentalize. I learned that personal grief is separate. And unfortunately, in the US healthcare system, you can take time off for immediate family members' demise, but you can't really take time off for, oh, mere cousin ki death ho gayi, mere chachu ke bete ki shadi hai, these things. And you learn those skills, and then you learn to compartmentalize. You learn how to control your anger, your grief, and all that stuff. Sometimes you become resilient. Sometimes you learn the value of timely help. Somebody died because they didn't have access to right medicine. Somebody died because they couldn't reach the hospital in time. So you learned that how important the value of EMS. So all these messages that you get, and if you don't have a personal tragedy, if you don't have a death in your family, please don't make one. There are always significant, meaningful, impactful experiences from other avenues that you can use. I hope that answered your question, Mariam. Do you have any follow-up question?
Yes, thank you so much, Dr. Tariq. I have one more question. Actually, a couple of more questions. First of all, I want to talk about the personal statement. Is there any hidden structure to it? Like, most of the people sometimes think, oh, you always start like a whole thing with, oh, I have emails and everything. Oh, I am Dr. Mariam Mahmood. I am this. So I'm pretty sure that is not how you write a personal statement. And just to clear that all of these things out, is there any structure to it? Like how we should always have graphs for every graphs or paragraphs for every experience that we tell, and it should be like one paragraph, one story, something like that, like a hidden structure to it. Because the general is that you write about experiences and everything.
Yeah, there is, and we're gonna have a webinar on personal statements, so we'll address it then. Just because this is more towards CV writing, and in the interest of time, we'll keep it focused towards that. Also, I would recommend you to listen to my videos on how to make personal statement. We talk about that. So
can I add something?
Yes, please go ahead.
About impactful
yes,
experience.
Absolutely.
So basically, what I'm thinking is when you're putting something in your personal statement, you can, corroborate that with the impactful experience. Like, for example, I give you my example. So my father is a pathologist, and like in my personal statement, I said like I used to go with him, see my microscope, see slides. That made me interested towards the field of medicine. But then I had option either to go in internal medicine or either to go in pathology. And then, in my personal statement, when I came to US, honestly, I was more into, internal medicine. But then one experience that you can put in your personal statement and in your impactful, and this is an example of pathology. Like, I was rotating in Vermont, University of Vermont, in Department of Pathology, and we do a lot of frozen sections. So one of the frozen sections was like there was a young female and she had an abdominal mass, and this is my own example. And so frozen section was called, and let me tell you what frozen section is. The surgery happens, and then they send you a piece of tissue, of the specimen, and they want you to tell us, pathologist, is it benign, is it malignant? So there was this young girl who had this big abdominal mass, and she came for operation, the surgery, and we were called. The pathologist was called, and I was a visiting medical student. So the frozen section was sent to us. My attending, we did that, and it came out to be just a benign cyst. So that means the surgery was limited, and when the patient was told of the diagnosis in post-op, she was very happy. So this was something that I really impacted me to become a pathologist, because I came to US either had an experience in internal medicine, or to choose pathology as a field. So I chose pathology because that really impacted me, and that really shaped my career in a way that I would I took it so seriously that, oh wow, as a pathologist, you are a very important team member of surgery, of radiology. Like Umar is, interventional radiologist, and he knows that, I don't know whether you guys do adequacies or not, but always there is a pathologist, and we guide them, is the specimen okay? Are we able to make the diagnosis of what they are giving us? See, so these certain things as a medical student, or as and a future MD, or when you are an MD and you're applying for whether you want to be a pathologist or a psychiatrist or internal medicine, something that shapes your career, that can be an impactful experience, and you can mention both in your personal statement and in your impactful experience. Or maybe as there is like death in the family, maybe my grandmother died of adenocarcinoma of the lung, and she was non-smoker, and which is very uncommon, but the therapies that were available in Pakistan at that time, we couldn't save her with that. See, then that's another thing that comes in your mind. Oh, if I go to US and I learn and I become a hemonc, or I maybe get exposure to these therapies, and maybe I come back to Pakistan and bring these therapies, targeted therapies back home to Pakistan. I don't know what your career plans are, but most of the time, that's what you're thinking, that, oh, maybe I might go back to Pakistan and introduce these things in Pakistan, and introduce these targeted therapies that can help the patients over there. Or maybe if I don't want to go there, but at least transfer my knowledge or something that I can give back to Pakistan would be helpful. So these small things, and then USMLE failures, that is making you very hardworking, even more resilient to continue your career. You never gave up. So all these things can be part of your impactful experience. But for me, the impactful experience was whether I want to do internal medicine or whether I want to do pathology. See, being a daughter of a pathologist doesn't mean anything. I could have been, my scores were pretty good. I was fresh graduate. I could have chosen internal medicine. But then, this was something that just changed my mind. And I just thought, since I'm that important member of the team, of the physicians, although I'm not communicating with the patients, but a lot of major decisions of therapy depend upon what I say. So this was something that really just changed my mind, and I focused towards pathology, and I said, all right, I'm just going to be a pathologist, not internal medicine. So that was something I wanted to add.
Thank you very much, Dr. Qureshi. A quick question to all the panelists. So we have 4 people, including myself. So starting with Selena. Selena, did you mention death of a family member in your personal statement? Or
Alhamdulillah, I haven't had any deaths of a family members. So I did not. Yeah.
Sultan here.
So I have to say that I did lie during my internal medicine residency application about the death of my grandmother.
गलत जवाब भाई, यही नहीं देना था यार, यही जवाब तो नहीं देना था. अच्छा चलो.
She was dead. But there was not really an impactful experience for me. I was really young when she died, but I did put that in just because of peer pressure. Everybody else's grandmother was dying, so I put that in too in my residency application. And I really, once I went on the other side and I was reviewing the application as a chief resident in my residency program, I said, man, why did I do that? But anyway, I still matched. But when I became more mature and I was applying for my GI fellowship and everything, I realized that those things were not important at all. So
sure.
Yeah.
Amna Bachi, did you mention death of a family member?
No.
Okay.
I mentioned what I saw in my
Good. So that's the whole point, right? You don't need to kill someone in your family, if to match. So just say that, be honest. I'll tell you, and I'm sure Sultan can also advocate for that he was a group PD at the University of Buffalo GI program, that we appreciate more honest and genuine people. If you're lying, we can see through that. We are very smart. We have been through this process. We review hundreds of personal statements and CV. We can see through an applicant who is lying, who's not lying. One more thing, very interesting one, your CV, personal statement, and your interview skills should be consistent. What I say is, once I reviewed a personal statement, it was one of the most beautifully written personal statement. I had to Google words. What does this even mean? And then I looked at the CV, and there were punctuation errors, grammatical errors. And then I talked to the applicant. She couldn't even speak 2 sentences properly. Then I asked her, who wrote the personal statement? She said, my friend did. She's an MA English. So, of course she didn't match. So that's the whole point. I'm trying to be consistent, yes, take other people's help, but make sure you're not just sending your CV or personal statement, send both. Make sure you practice with that one person for your interview skills as well. All right, Mariam, did that answer all your questions? Or do you have any other follow-up questions?
I have one follow-up question as well. Sure. This is my last question. So now I want to talk about research experience. In your manuals, everything, they ask about research experience, which is different than published researches. So if somebody who doesn't have visa in the US and wants to do like a research experience, like all people who are coming here for observership, what options do they have for like to gain research experience? One part of my question is that, and second part is that if I want to write like a lot of things in my research experience, would like working as when I did my house job back in Pakistan, so would working and collecting stats and filling out questionnaires, will that count as a research experience?
Okay, thank you, Mary.
Thank you.
Any of the panelists want to take that?
So from a research experience, so when I was in Boston, Bethesda, we actually had observers coming in from like Nigeria, from Brazil and other places all the time. And there was like a very clear difference between those observers and those coming in from Pakistan. And the difference was that they were proactive. They were the ones who were bringing up ideas. We saw a case, they said, I want to write up this case report. They did not have direct access to the medical records. So they said, just give me the information. I will write up the case report. So I just gave them the information, which was de-identified. They wrote up the case report, which was published. Or they say, I'm going to do a meta-analysis. I just want you to be a supervising attending on that meta-analysis. So they wrote up the meta-analysis. They did everything, and you were kind of supervising them. So there's a lot of research you can do without direct access to the medical records or without even physically being there. If you want to write a case report, I would have cases that you can write up. But again, why would I trust some random person who's sending me an email? I would rather have somebody who's already there during an observership. So that is your opportunity to be proactive. And that's your opportunity to say, I want to do it, instead of expecting the attending to spoon feed you all of the information and to do the research. That would be my way.
Thank you.
Look things up. That's on you. You can make it as much. You say, I have an idea for writing a review article, or I have an idea for doing a meta-analysis. I will learn meta-analysis. I will put in the time and the effort to do it. So.
Thank you, Sultan. So yeah, to add to that, so Mariam, when you're mentioning research publication, that's always a product of a series of hard work, right? But then when you're mentioning research experience doesn't always result in a publication. I did a lot of research at Johns Hopkins and my name was not in publication. So I mentioned that as my research experience, that, I was a student collecting data. So it's, so then you mentioned that from this experience, though my name is not in the publication, but I learned data collection. I figured out how to do Excel sheet. And then there was another project. Again, my name was not in there, but I learned stats for that. So I did all the statistical analysis. So research experience is that kind of experience. Even if you it didn't end up in a publication, as long as you did something reasonable, it was research, you can mention it. A very good friend of mine, Ayaz, he mentioned 2 papers in American medical journals as a 4th year and final year medical student, at KU. So he did review articles himself, and he did meta-analysis. He did all that stuff as a medical student in Pakistan. You can all do that, and I know multiple people who do that every year. So you can do all that stuff. But then again, if you did something, it was even a community medicine project, and you really put in the effort to collect data, you learned all that, then you mentioned that as your research experience. You don't need to lie and fabricate. Also, one more thing I have the data from last year's match and unmatched applicants. The most unfilled section of the entire ERAS CV for most of the applicants who matched was actually research experience. So a lot of them did not have research experience. Research is significant if you are an old graduate, if you are somebody with low scores, or CV, or applying for higher end specialty. Yes, if you have research, you match at a very good program, but a lot of people who match actually don't have research. So just know that. Okay. Did that answer all your questions, Mariam? Okay. Next, we will go to Muhammad Abdullah, and after you're welcome. Thank you, Mariam. After Muhammad Abdullah, we will go to Meena Bai and then Umar Nisar. Go ahead, Abdullah, please come forward.
Welcome, and a very good Sunday morning to all the panelists and hosts. You guys have been helping a lot since the past hour, and of course, all these past years as well. I just want to first thank Dr. Mahmood for lightening the mood and mentioning that detail in his personal statement to what not to do. And thank you very much for that. So I have 3 questions regarding the CV and a question regarding the personal statement, but I'll ask Dr. Tharik's permission before going ahead with that. The first question regarding the CV is about this section that's called geographical preferences. I'm terribly sorry, I didn't introduce myself in my graduation year. I graduated from Islamic National Medical College, Rawalpindi in May 2023, and I'm currently working as a clinical extern at Norman Regional Health Center in Norman, Oklahoma. And yeah, coming back to geographical preferences, this particular section it allows you to click on the preferences that you want to do your training at. And I was wondering how it can impact the chances of the program and how the program will see this. Because if we click on a particular preference, that programs in that particular region can see it. And if we do not click on that particular preference, programs will know that we don't have a preference. So how does this whole thing play out? Should you pick a preference, and does that help? And if you don't, does that counterweigh on your application? So any panelist?
Okay, yeah, let's answer this question first, and then we will take the few questions. Any of the panelists want to answer that? Otherwise, I will go ahead and answer. Do you guys have any idea about this?
So I would prefer. Okay, go ahead.
So I think geographical preference for residency as an IMG, I personally would not pick any geographical preference unless you have strong family ties, or if you've lived in a particular region, you've worked with somebody's particular. Yeah, maybe I think it's more important for fellowships once you've established, roots in a particular state or some region, you might prefer to be in that area going forward in the future.
Okay, thank you. Dr. Qureshi, please.
Yeah, no, I definitely agree with Mariam, Dr. Arif, that I think we should not pick any regional preferences for now. Keep it open, whichever. Right now, we just have to get into the system. So if we want to get into the system, just keep yourself open to all the options. Just don't limit yourself to one region. That's my personal advice. Unless you are really like your wife is working there and you have little kids and you don't want to move, or your parents are there and you don't want to move and you're the only person who's taking care of them. These things, but overall, I think you don't restrict yourself to any particular geographical region.
Thank you. Okay. Well, with all due respect, I might beg to disagree, and I'll tell you why. So, Abdullah, do you have any strong family ties? Do you बच्चे कहीं पे भाई बहन कुछ?
I do.
कहाँ पे यार? वो तो सबसे important बात थी. That was the first thing you should have mentioned. Okay, go ahead.
I didn't answer the question first. Okay. Oh yeah. So I have family members in Connecticut, basically, and in
Illinois. Connecticut में कहाँ पे?
In Windsor, Connecticut. So it's near Hartford.
Okay. And where in Illinois?
Naperville, Illinois. So it's near Chicago.
Okay. Yeah, I was in Naperville yesterday. Okay, good. So that's the thing, you gotta, so you can use that to your advantage, that you can talk about your relatives. That really works in your favor. And also I'll say email programs, when you apply that, email all the programs in Connecticut and around Naperville that you have family and you love to be in this area. So that can impact which geographical preference you do give. So the thing is, if you don't give any geographical preference, it doesn't hurt you, it doesn't help you. Yeah, it doesn't help you and it doesn't hurt you either. What it does is it just, the programs don't know if you even did it or not. The only programs who came to know that you picked them, you picked it at certain geographical preference is, let's say if you picked Illinois. So for that reason, there are two schools of thought. One is exactly what Dr. Qureshi and Dr. Arif mentioned, that you don't pick anything, but then you lose that advantage of that geographical preference that area would give you, right? So what I recommend is I did an analysis with a bunch of people 2-3 years ago, and we looked at where do we have the maximum density of programs. What I mean, which region has the maximum number of IMG-friendly programs? And that turned out to be the region of New York, New Jersey, Connecticut, Pennsylvania, DC, Baltimore. So starting with that, like New York, New Jersey, Connecticut,
Northeast and Central region.
Exactly, Northeast, yeah. So for that reason, just because the programs do value, before last year, geographical preference and signaling was not that important. But last year, a lot of poor people who got interviews, see, these are the things you have to look at stats. You can't rely on word of mouth of 2 or 3 people. So let's say if 20 of these people, 20 of the applicants signaled, 14 to 16 of them did get interviews from the programs they signaled in the geographical area they mentioned. So if you talk to only the 3 or 4 who did not, they're going to tell you it didn't impact. So we collected data from last year, and based on that experience, signaling and geographical preference does matter. So let's say if there are PDs who will always interview people who have, like, let's say there is a person with similar score, similar CV, they're going to interview the one who has signaled them. And because there are a limited number of signals, and you can only mention few areas for geographical preference. Because the maximum density of IMG-friendly programs is in New York, New Jersey area, so I'll say that should be your top geographical preference. But that is only if you don't have any real other geographical preference. If you do have family in Illinois or Texas or Florida, then you should, and how important it is for you to be close to that. Like the family is your family, or these are your in-laws?
It's my grandparents, so I would love to be close to them.
Okay, good. So sometimes it's a different story. Your family doesn't want you to, your wife doesn't want you to be with your in-laws, right? So then you're like, okay, this is geographical preference against, I can't go to this region because whatever, jokes apart. So this is how it works.
Graduated, so there's no in-laws.
Okay, not yet, right? So that's the whole point, that this is up to you. And then there are people who are like, why even take the risk? The thing is, if you mention geographical preference, it might go into your advantage for those programs. If you don't get any added advantage anywhere else. Okay, what's your follow-up question?
Thank you very much for that. So the next part of the CV that I want to talk about is the experiences section, of course, the most important, if at all. So like I said, I just graduated in May, and as far as clinical experience is concerned, I have, and I had an away rotation during my final year med school in New York. And now I'm, as I said, externing in Oklahoma, and I have another one in Alabama. These experiences, so the elective rotation, I understand that it can be categorized as education and training. But the experiences that I'm doing now after graduating, do they count as education or training, or do they count as work experience? Because this is something that
work experience is only if you're getting paid. अगर आपको पैसे मिल रहे हैं ना, if you're getting dollars, if you're getting paid, it's work experience. So postdoctoral research fellow, research assistant, medical scribe job, all these things that in which you get paid, those are work experience. If you're not getting paid, it is volunteer. If it's, let's say you're working as a research volunteer, you're going to the hospitals, moving patients around, that is all volunteer. Unpaid is volunteer experience. If it adds to your education, if it's an externship, observership, that could go into educational experience. Volunteer is unpaid work. Paid work is work experience. Got it?
What I'm concerned about, Dr. Tariq, over here is that if I do that, then my work experience profile really squeezes it to one.
Doesn't matter. Does not matter. Don't lie. Don't fabricate. If you haven't been paid to do something ever in your life, just for the sheer, reason to fill the blanks, and don't do that, please. That's the one thing I would say, that, be honest, be genuine. If you don't have research experience, please don't mention it. If you don't have work experience, please don't feel obligated to create one or fill in that. Nobody cares. This is an interesting question. Let's say, how important, I'll start with Sultan. Sultan, how important it is to make sure that all these sections are filled for you when you're reviewing CVs for fellowship and residency?
I mean, all the sections don't need to be filled out. Unless you have something to add. I mean, just like you mentioned before, something that I can look at and say, this would be like a meaningful thing that the other person has done, which would make him a better candidate. I mean, that'd be useful, but you can't make things up. And the worst thing you can do is that if you get caught by putting something in there which you have not actually done. Like you put in some research experience about like something, you say you have published a paper and you ask about something and they don't know what they're talking about. Or you say that you have worked in a cardiology department and then you talk about something, oh, what were you doing in the cardiology department? You can't really answer those questions. Those are the things you really don't want to do.
Thank you. And also, Abdullah, like I said, if you, let's say, put your externship experience or your research experience and work experience, that actually makes you look bad. It shows that you don't know what these terms mean, right? So be more honest. Like if you're putting work, like your work as a research volunteer or your work as an observership in a work experience, that shows that you don't understand what work experience means. Okay, and at the end, you will see a lot of diversity of opinion. I'll tell you, there are a lot of YouTubers, lots of medical influencers who are misguiding people. There was this video I saw yesterday that don't even pick J1/H1. It's all, you don't need to listen to everyone. You got to look at the authenticity of the information and the person who is providing you that. Are they really a part of the, resident interview committee, the selection interview process? Everybody has an opinion. You can give me your opinion on something, but is it really authentic? So just for the sheer reason of putting something in there, I would suggest refrain from that and be only genuine and honest. In the interest of time, we will move forward. Do you have any other questions? I'll take this last question.
Very small question about the personal statement.
Personal statement. See, again, I'll give you guys a quick blurb. I'll say that it should always start with a bang. It should be captivating. People should feel obligated because to read the personal statement. If it's boring, if it starts with "my name is Dr. Abdullah" and all that, it's boring. Nobody's going to read it. So end with a bang. Start with a bang, end with a promise. It should be memorable. And then in the middle, it should try to answer a few things, if you can: why you became a doctor, why this specialty, why their program, where do you see yourself in 10 years? And then you can, one more thing very quickly, you should, rather than just saying I'm very dedicated, hard work, your personal statement is your place to exemplify. It should be not more than 1 page long, but you should be giving examples that why are you saying you are hardworking? You narrate stories, you narrate experiences. But we will have a workshop on personal statement very soon. So we'll address all the questions related to personal statement in detail for that, okay? Any other questions?
That's it. Thank you very much.
Thank you, Abdullah. All right, Meena Bai, you're next.
Hi, everyone. Thank you so much for this informative session. I'm Meena Bai, and I'm originally from Pakistan, but right now I am in New York. I'm doing the rotation. So I do have some follow-up questions that if I do the geographical preference to the New York, as Dr. Matarik said, do the other programs know about my preference?
No. Only the programs that you ranked, they know.
Okay, I mean, it will not affect more, other programs know about it. Okay.
No.
And about the work experience, volunteer experience, if I'm doing rotations in multiple hospitals, where can I put this experience?
Say that again.
If I'm doing rotations in the multiple hospitals, so I mean, in which category I would write this experience
in what capacity are you working? Are you doing observerships?
Yes.
Then educational or volunteer, educational preferably. If that is helping, if that's for your education, then it should be educational. Okay. If you're working as an intern, if you're getting paid, then it's a work experience. If your title is a volunteer, research volunteer, medical student volunteer, patient advocate, something like that, if it's volunteer, then it goes in volunteer.
Just like as a clinical observer or clinical extern.
Right. That should be an educational experience.
Okay.
Okay.
Yeah. And I had an other question. I didn't match last year, so I tried to improve to make my strong CV more strong. I got the rotations in multiple hospitals in different states. And I also joined American Red Cross as a volunteer, and I also joined the Toastmasters to improve my all communication skills and interview skills. So should I write this as my impactful experience?
If you don't have anything else that is impactful enough, and don't feel obligated to write one if you don't have.
No, other than this, I don't have, I think so.
That's fine. So you can either leave it blank or mention it there, okay?
And you
Anything
can
else?
add impact in impactful experience if you have something interesting happening at Red Cross. That can be your maybe that has made you choose certain subspecialty for future. You can add that in your impactful experience if you want.
Okay.
Thank you.
Thank
Any
you
other
so
questions,
much.
Meena? Okay.
No, thank
No
you
worries.
so much.
Thank you. Next, Omar Nisar.
Hi to Dr. Tariq, Dr. Qureshi, Dr. Mahmood, and Dr. Arif. Thank you so much for arranging this session. I am Dr. Umar Nisar, and I am a 2021 graduate from Shalamar Medical and Dental College. So I have a couple of questions. My first one is that in impactful experience right now, I'm in Dearborn, Michigan, and I had a lot of trouble finding accommodation because the accommodation which I booked canceled on last minute, and I arrived at the night and I had no accommodation. I had to go to a hotel, stay there for 2 days. So can I mention that in impactful experience, or I have a habit of overthinking which I overcome each and every time which I have to do anything, like for example writing any document, or I don't know how can I explain that. So which one would be the more impactful one? And the second one is regarding community medicine project. I was the first author and kind of the team leader for my community medicine project. I helped to get approved IRB, and then I got it published as well. So does that count as research experience?
Yes.
Thank you.
Okay, so quick question. When you arrived without housing accommodation and you had to stay in a hotel, what did you learn from that experience?
That you have that I was not going to go back, because at one point, because this was a really good rotation and I was going to do it no matter what. And I said that, yeah, probably resilience, I think.
Okay, then you can mention that. It's important that, your impactful experience, you share what you learned from that, and same thing for your other questions. What did you learn from it? Did you have anything to share that you learned from it? I'll let other panelists answer if any one of you want to mention something.
Yeah, I would just say you're overthinking it.
Thank you so much.
And it's important to say that, how did you overcome your overthinking and what did you learn, right? These are all the things that matter.
Okay.
All right.
Thank you. I have just one follow-up question.
Please.
Should I, my 10th experience, I have accounted for the 9 experiences, but the 10th one, should it be the research experience, or should I keep one to the hobbies? Because I have a hobby of aviation and traveling, and I like to collect aircraft models. So should I keep that as a hobby, or yeah?
For what experience are we talking about? Meaningful experience or impactful experience?
No, the 10 experiences which you have to mention in the ERA CV.
Yeah, so it really depends. What are you going to share? What you learned from this? You can mention either one. Again, what matters is how it impacted you as a person. What are the impact of these experiences or hobbies on your personality? You learned how to manage funds. You became smarter. You learned how to become more organized. What did you learn from all this? That's what matters.
Okay. And just a last question. I'm so sorry. As we were talking about the visa thing, some people say to just tick the J1, because as you tick H1, J1 programs won't prefer you. So is that a thing, or we should go on ticking for both of the visas?
Tick both of them. That's wrong. And that's what I shared in the group yesterday. That's just wrong. You should tick both. And it's not like J1 programs will rank you lower. They'll rank you if they like you. Okay.
Thank you so much. Thank you so much
You're welcome.
for
Thank
answering
you.
all of my questions.
Yep.
Mark, can I add something?
Please,
the
please
hobbies thing.
go. Yes,
so for
absolutely.
the hobbies, I think it is one of a very interesting part of our CV. I've seen people discussing about NFL's basketball, and the entire interview goes on it. See, he has a very interesting hobby of aviation and model collection. Who knows, your program director also likes it. So don't underestimate your hobbies. Always, hobbies need to be like, one of a very important part of your CV. Maybe traveling, you like traveling, okay, maybe the other person who's interviewing also likes traveling, and the whole interview goes on discussing about one place that you both visited. And then same goes for the books, like maybe you guys have a similar favorite author or a similar favorite book. So basically, when people are recruiting residents, they just don't want to recruit nerds. And it's not a bad thing to be like very well accomplished in your studies. You have to be like any other human being, like they are just like any other person next door. So just showing that you have spent all your life studying is not going to help you either. You have to be like an overall, like a normal individual who has hobbies, who loves traveling, who likes watching movies. Maybe you like a Netflix show, and then the other person, like maybe the residents, they when they interacted with you during the lunch session, and you say, oh, you know what, I like this, he's my favorite actor, I've seen these movies. And then the residents who have interviewed you will give a positive feedback that this guy is gonna be very is very collegial, and he shares the same interest as us, and he's very friendly and easy to approach, not just like someone who's very introverted and who's who's just doing medicine all his entire life and who has these brilliant USMLE scores. So I mean, be an overall normal individual who has likes and dislikes, who loves watching television shows, who likes watching games, even cricket. Now in US, cricket is becoming popular. They've been, you can discuss about cricket too, like, so don't underestimate hobbies. I think you have a very interesting hobby, and just, bring it up in your interview. I mean, it's going to help you in the interview session, your hobbies.
Thank you very much. So in the interest of time, and since this is Sunday morning and people have other obligations, we will not be taking any more questions after these last three people who are added as panelists. So we have Wase Hassan Khan, Hamza Hussain, and there was a Rabia. I think she's still there. So we'll take questions in that order. Wase Hassan Khan, please come forward and ask your questions.
Hello, assalamu alaikum everyone. Hope everyone is fine. My name is Dr. Wase. I'm from Khyber Medical College, batch 2018, and this will be my first cycle of application. So basically, I'm working as a PG3 radiology in my home country, and so just a little background. When I started my, after my house job, I pinned down that I just really want to do something that is really impactful. And I just narrowed down it would be definitely, for me, it was either hem-onc, or either it would be intervention radiology. So in Pakistan, we never had intervention radiology as a primary, residency. You have to do fellowships and you have to do FCPS, and after that you have to go for the fellowships, and it's not like that which is in US. So now that I'm PG3 and I've taken my USMLE exams as well, I've been scored pretty well as well on both of them. So, but now I'm talking to my seniors, and everybody's telling me that to go for intervention radiology, you have to, have a really strong research background in the US as well. And it's highly competitive. They prefer their own people. They prefer obviously these everybody was telling me not to go for that, especially not in this cycle. And so the problem arises here that I have financial constraints. Despite of having, working hard for it, building my CV, I went into radiology and diagnostic radiology to go to intervention radiology in future. That was my plan. I just want to have hands-on, work in my life. So now that I'm here at this point, everybody's telling me not to go for IR. either switch back to your old preferences. Like I just also liked hem-onc as well. So now I'm confused. And if I'm applying for hem-onc, like I am basically. So how do I, mention that in my personal statement? And how can I convert that into my, impactful experience or something? Like everybody will ask me this, that how are you switching it? I have my own, answers to that, but I think everybody would find out cliche that this is cliche and they won't buy it. I know that. So just a very specific question.
Thank you, Vase. So since I'm an interventional radiologist myself, that should tell you that you can become one, right? So there are interventional radiologists in America, and actually I run a group of all the radiologists in America, and there are more than 100 of us from Pakistan. I also run a group of all the radiology applicants from Pakistan. Radiology means DR and IR. And for the past 10 years, we always have had 1 or 2 people match into radiology. It's just the number is pretty small. IR is the most competitive specialty to get into for the past 5 years. And DR is probably like 4th or 5th. So it's not like it's impossible, but yes, it is not easy. It's by no means easy. It is very competitive. It is possible, but your CV needs to be good. Now there are multiple things for you. If you do your FCPS part 2, then you can do a alternate pathway, fellowship without residency. IR is actually the most competitive fellowship to get into after DR, if you want to do that. Or if you want an direct IR residency, you can do that too. But it's just very competitive. So for that, I'll say if you want to go into IR, I don't think anybody has matched directly into IR in the past few years without research. So you need to have research for 2 to 3 years. You can still apply for DR, but your chances will be pretty low. And I would say join our radiology applicants group. Send me a message, I'll add you to the radiology applicants group. And then all the people who have matched into radiology in past 15 years, they'll all be there, and they can also guide and mentor you. Okay? Did that answer your question?
Yes, I did. But okay, so if like you said, it's very competitive, and I cannot financially, sustain a research 1 year or 2 years in US. So if I decide against it, and I apply for IM, how do I, portray my CV? How do I change that?
Right. So I was in that situation 12 years ago, and I got like 10 radiology interviews, and guess how many IM interviews I got? 0. So radiology is more competitive, right? But my CV, if you look at my CV, all my research was in radiology, all my work was in radiology, all my lectures were in radiology. So they knew that I'm applying for internal medicine as a backup. So if you're in a similar situation, this can happen with you too. And no matter whatever you do, you can't go back and change your past and create new experiences in IM. It would be actually more challenging for you to match into IM with a CV of radiology. So just keep that in mind. Just prepare your goal, think about what you want to do. You can always switch specialty, but then your story will be completely different. Okay? Then you will be focusing more towards why are you switching? All right, in the interest of time, we'll take last 2 questions. Thank you, Wase. Hamza Hussain.
Assalamu alaikum. Good morning. Thank you for having this Zoom meeting with us. It's very helpful. There's a lot of questions that I had that were already solved. And yeah, just a little bit about myself. My name is Hamza Hussain. I graduated 2022 from Dow International Medical College. I worked as a house officer there for 6 months. From there, I took a little bit of a break. I did my step 2s. Then I moved to here in Chicago, and this is where I am right now. I'm living in Wheaton. I was actually in Naperville yesterday, just visiting family. So I know we might have passed on the road, Dr. Umar. But I have 2 questions. These are questions that I have probably asked already on the group. Right now, I was looking for work. And alhamdulillah, I got a position as a medical assistant. So my question was that, is this on the level of an observership? Because this specific position that I'm doing, it gives me EMR access. It gives me, it's training me to take vitals, and it's also like a little bit of surgical work too. So it's a really good experience. This is something that I'm definitely putting on my CV, because my entire point of my personal statement in CV is that, hey, I'm really passionate about medicine, and I want any and every avenue. I took any and every avenue to get into the clinic, get into the wards, get into the hospital, and see patients and interact with them. So what do you think?
Any of the panelists want to take this question?
I think it definitely counts. Sorry, it may be a little bit loud because I'm outside. It definitely counts as work experience. I don't know if you're getting paid or not, but that's a separate question. But it doesn't just give you the skills; it is also giving you the exposure to the U.S. healthcare system. So when they're looking at the applicants, you would definitely stand out as someone who's like directly involved in patient care. So I think, yeah, so it shows your time and commitment to, it's a different position that you're doing other than a regular, like an elective or an externship. So it definitely shows your commitment as well as highlights your exposure. So I would put it on the CV.
Okay, thank you. The other question is that, what about dual applying? Because, well, while I'm committed to internal medicine, I want to have my bases covered, and I was looking at emergency medicine. There were several things that I was impressed by, and one thing that I wanted to do from internal medicine was subspecialize into pulmonology and critical care. Another avenue that I could take is go into internal medicine and then subspecialize directly into critical care. So, how can I be smart about this? How can I make my personal statement and CV that reflects both that I'm interested in emergency and internal medicine or something? Or is that very difficult to do?
I would suggest you should write 2 separate personal statements for both of them. Write one for emergency medicine, one for internal medicine. The CV is going to be same. You can't really change that in your CV.
Okay. All right.
You can have separate letters. You can have separate letters for both the specialties too. You can ask your letter writers to write a separate letter for internal medicine and a separate for emergency medicine. Okay.
Okay.
Did that answer your question?
Of course, yes, it did. And just one final question. This is a little bit probably just my sort of overthinking here. I wanted to kind of metagame the entire process by seeding questions into my personal CV. So I just like go into just enough detail to mention that, oh, I did this or that. And I want that question to be reflected back into the interview. Is that something cool? Is that something that I should do? Or should I just keep it simple, stupid, and just make sure that I have a good CV, good personal statement, and stop with this, metagaming aspect?
Yeah, I'll say you're overthinking. But more importantly, like I said, for personal statement, we will have a separate webinar. We'll address it there. CV, you should mention everything, and it should be beautifully summarized. That's more important. And what is the number one thing that I can tell all of you guys for your CV is actually that there shouldn't be any grammar errors, punctuation errors, or spelling errors. So make sure for all of you guys, that's how you do it. Any other question?
Okay. That's it. Thank you so much.
So can I add something?
Please.
Can I add something?
Yes, please.
So you can also do find a rotation in critical care, find a rotation maybe in urgent care or something, and you can add that. And please make sure that your CV is not jumping like all over the place. If you are interested in these 2 subspecialties, the thing is just you will have only one CV. You cannot make 2 different CVs for ERAS. So try to make it focused. You add an experience, a rotation experience for pulmonary critical care if you want, and then you can add like maybe 2 months or maybe a month of emergency medicine. It doesn't hurt. And maybe you can get into an urgent care that will make you, have an experience in that kind of a field. So just but don't just jump from one place to another, because you'll only have one chance of making a CV. But I agree with Omar. You can have 2 different personal statements, and you can have different LORs. So, but just your CV needs to be very focused in what you're interested in, not like you're doing something in psychiatry because you just got this rotation and you didn't want it to waste your time. And so you did psychiatry, and then you did 3 months in pathology because you just got this rotation that is available and you didn't want it to waste your time. But I think doing MA-ship is going to really highlight your CV.
Absolutely, completely agreed. All right, Rabia, you're the last one to ask questions, so please come forward and ask your question.
Hi, Assalamu alaikum, and thank you for having me, and thank you so much for organizing such webinar. So I actually have a question that, in Pakistan, people approach to you and ask for help, that even if you're a house officer, they don't know, but they know that you're a doctor. So they approach to you and ask for help that my patient is, my father is ill, he's diagnosed with cancer, or he's in that ward, And sometimes it's not in the MEO hospital, sometimes it's Jinnah hospital. But I was involved in the patient care at personal level. Like if they call me and if they're saying that he is not in good condition, I went to the Jinnah hospital sometimes, and I also go to their home sometimes if they are very worried about it. Then what should they do? And if they live nearby, or sometimes. So should I mention that in CV or in personal statement in any way, or is it just unprofessional thing? Because it's but it was not involved in like I was not I'm a very great doctor. It was not like that. It was helping in them understanding their diagnosis and everything, and helping them to look at like where to go for these tests, and also like for make them contact to the professional, like professor, doctors, or like direct them to the where should they go, because in Pakistan they don't know much about where they should go. They mostly go, even for cancer, they're just neglecting their illness. So should I mention this in any aspect in CV or personal statement?
Salina or Sultan, either one of you want to take that?
No, I think this is great. I think if you're doing something on a personal level, you can give it a name that I run my own personal, I guess, clinical service, advice service to patients who don't have direct access to medical care. And that's completely fine. I mean, you can just run it in my own town or in my own city or in my own relatives. I am the main point person who's doing this. This is a very personal, this is a very unique experience. Most of us, again, have not done that or don't really do that. So that is definitely a good experience. You should definitely add it to your personal statement. And that is something that you can definitely talk about too when you come in for the interview.
Salina, would you like to add something?
From the experience, like the key characteristics of the primary focus area, you can always select advocacy. So I think there is one category on that. So patient advocacy or improving access to care. So I think that's very relevant. You can definitely add that in your personal statement, even in the CV, just like Dr. Mahmood said, just maybe give it a name, just whatever that you want to.
Thank you. Amnabaji, you wanted to add something?
Yeah, I think it's very wonderful you did that, and you can say that you learned patient counseling, or like how to counsel the family, like through this skill. And I think it shows your compassion towards the field. So I think it's very impressive. Do mention it.
So Rabia, I did something similar, and what I will say is just mention that you were a patient advocate volunteer, and these are the things you did. I did something similar, I mentioned, and then there were a lot of follow-up questions. See, again, I will repeat that the people who are interviewing you, they are very smart. They will figure out if you're lying. So they will ask you stories, and then they will ask you follow-up questions. And this happened with me, and I was grilled with questions after questions after questions. And since I had all the answers, they knew I wasn't lying, and my story was consistent. So just make sure if you mention something like that, they will ask you questions about it. Just be coherent. Make sure you have answers to your questions that you're mentioning. Okay. All right. Did that answer your question, Robin?
One more question, just last one.
Okay.
Yeah,
Please,
thank you so much for answering me. Just one more question regarding the impactful experience. Can I mention some, because during my final prof, my father was diagnosed with TB and superimposed infection, and he was critically ill. And then I had to make him admit to the MEO hospital. And I was living in the hostel at that time. And I couldn't study like by just, sitting in library. I was just, how government hospital works there. So I have to say some doctors to see in 3 times a day, and also arrange for medicine. I have no brother, so I was going all the way, and I was also studying at night. So it was very hard time, if I remember. So can I put it in impactful experience?
So you have 4 Cambodians here and 2 female Cambodians. I'll let both of them answer, and then I'll add to that. Dr. Qureshi and Arif, please go ahead.
You mean in the overcoming challenges section? I think this experience would definitely go under that. It's a personal challenge. It's your dad, and obviously your family, your parents are really important to you. And then it was at the time of your final professional examination. So yeah, for sure, it's a small word count. So just make sure it's within the word count and highlight the most important aspect. How you overcame the challenge, that's important. So that one of you guys were talking about not it being not a sob story, and then what you learn and moving forward, how that's gonna help you deal with such situations.
Amna, you want to add something?
Yeah, I think I totally agree that it's definitely a big challenge, and you overcome this challenge with your hard work, with your resilience, and you not only that, you helped your dad, you helped your family, you also cleared your exams. So that makes you a strong individual who can work under all circumstances and who can take on challenges. So you might have a similar situation, like like you might have like a crashing patient, and then you have a you are sitting in your hospital setting all night, and you have an exam next day. So and then you cleared the exam. So basically it makes you a good resident, that you can take on all the challenges and yet you can accomplish what you're aiming.
All right, thank you. Rabia, I'm so sorry about your father. Is he doing okay now? Is he better?
Yeah, he's fine.
Okay, good.
Yeah.
So I hope he stays healthy. So tell me something, and as an interviewer, I'm asking you, what did you learn from this entire experience while studying as a final year student at, I'm assuming, KE, and while studying as a final year student and having your dad in the TV ward? What did you learn? How did this shape you as a person?
It makes me like more focused. Like in free time, we mostly sometimes waste our time too. But at that time, I like realized the power of time. And even if I get the 5 minutes, I just started studying in that time. And if doctor is coming, I'm waiting for in his office. I'm studying the I took the picture from the book and I studying. And also I'm a very emotional person. So I was one day I was very emotional. But when doctors said me that the doctor's daughter, the doctor who is also a daughter should be strong and shouldn't cry. Or so it makes me after that day I realized that this is what is happening, so I have to admit it, and I just I should be strong and not just cry on the situation, because obviously like prof was very hard, and also they were
yeah. So I told you, as an interviewer, I'm asking this question. You will work on this when you prepare for your interviews, right? Gather your thoughts, come up with an answer that is 2 to 3 sentences, and say what you learned from this entire experience. And I'll answer that for you if you can't do that right now. You learned to be strong, you learned how to be efficient, and you learned how to overcome challenges. That's it. Right? Just gather your thoughts, write them down, make it sound more easy to the ears. And the reason I mentioned, I can relate to a lot of it. I went through a lot of personal health challenges during training. My daughter had a surgery. She was sick. My wife was hospitalized. My parents were hospitalized. They had a surgery, and all this while I was in training. So I can relate to all of this. And the thing is, what I learned was very similar. I learned to compartmentalize. A family member, a very close family member, is going through a serious surgery, and at the same time I'm on call and I have to do procedures. That's how you learn that, sab saath saath chalta hai. You can't have so I think we as doctors are incredibly strong. A normal other people, they can't do that. So you can mention all this, that you didn't just take time off from med school for a year or something. You stayed strong and you stayed level-headed, cleared your exams, continued to fulfill your multiple duties as a student, as a daughter, fulfilled your multifaceted role. So that's how you should address this. Okay, and it is a very impactful experience. Did that answer your question?
Yeah. Thank you.
Thank you, Rabia. Thank you much. All right. So now we'll very quickly answer all the questions that are in Q&A if they haven't been answered. So Hamza Qureshi is asking that he's looking to combine multiple work experiences because of the limited number of experiences. And then he's asking what should be mentioned in the city and the dates. Please don't do that. Just mention one at a time, and just say that, rather than combining, unless you're combining, let's say, all your US clinical rotations, then it's possible. Just say 3 months of US clinical rotation, then you list US. After that, there is this question that if an undergraduate goes for 1 month rotation for electives, what is best, either to take 2 LORs of 15 days or the 1 LOR for a month, whichever is better. The content of LOR matters a lot. If you're talking about an impactful experience, how do we make sure it doesn't look like a sad story? Don't focus on the sadness. Focus more towards what you learned from it. Let's see, what else? How about,
I think there are some open questions and there are some answered questions. So maybe just go over the open questions. I think we have already answered most of the questions.
Perfect. Oh, I see. Damn. You guys answered 42 questions. Nice. Okay. Right. While we are at geographical preference, could we also discuss about our preference for rural versus suburban versus urban? How do we do this as an IMG? So I would say for this, you shouldn't really have a strong preference. You shouldn't pick one or the other because that really limits. And then I see Dr. Mahmood, Dr. Arif, they all answered a lot of questions that were asked in the Q&A. So I think that concludes our session. Thank you to everyone who came in here. I promised my panelists that we will try to wrap it in 2 hours, and we did. We still have 3 more minutes to go. So thank you all the people who could come on this Sunday early morning. We all have family obligations, and I really, really appreciate everybody's time. And we'll have Dr. Ashraf give his concluding remarks. He's our chairman of the Appna Young Physicians Committee. And thank you again. Aman bhai, please come forward.
Okay, thanks so much. Yeah, so I'm on the highway, as you can see, so just bear with some of the background noise. But thank you all the panelists, Dr. Mahmood, Dr. Arif, Dr. Qureshi, for joining us. And as always, Umar, thanks for conducting a very good session. So to all the applicants, there's only 2 modes of communication we have. It's our Appna Ypc Facebook page and our YouTube channel, Appna YouTube channel. And Umar can share the links of the YouTube channel here in the chat box. Please subscribe to them because that's the only way we'll communicate with you. On the Appna Ypc Facebook, you'll have all the notifications. For all the past webinars, they are available on YouTube. Like there were a lot of questions about personal statement. We've already conducted one, and we are trying to do another sort of a breakout session for that. So we'll see if we get around that, but it's already been done and a lot of information is available. But thank you, everyone. Thanks. Back to you, Mark.
Thank you, Naman. Yeah, so there are, in the Facebook group and the WhatsApp group, I'll share links to those webinars that have already been done for personal statements, like I shared them for CV. So yeah, just listen to them. Again, thank you everyone for coming. And if you're listening to this on our YouTube channel, please subscribe our channel, Appna channel, and give it a thumbs up so that it can get more popular. And we are already monetized, so we can generate more revenue